Okay. So, blood pressure medications are generally taken in the morning, so that during the day, it can keep, while you have a lot of cortisol and stress and all that stuff, it'll keep your blood pressure from going up a little better, because there's always a curve, like you absorb it and then you kind of gradually it goes down. Some medications like losartan you can take at night. Because of the way it works on the hormone system, the renin-angiotensin system, instead of dilating blood vessels. So it doesn't work in the same way. So you can take losartan at night.
Hello, everyone. There is Dr. Saunders. Awesome. He and I were having a discussion about some things here, and it's actually going to be a really good topic today because we had some questions last week about inflammation, and we're going to dig into this. I know Dr. Saunders has done a lot of research on this. He's reading books about uh, fasting and the impact on inflammation and all of that kind of stuff. But I want to talk specifically about what inflammation in your body could do to your heart and why it's important to look at inflammation. Before we get started today, though, I just want to let you know that Dr. Saunders is not your doctor. And so, whatever we recommend here today, please consult with your medical provider before you implement any of these things. There you go. Now you guys can see Dr. Saunders. Look at you. Look at that pretty background back there. Two beautiful paintings. Love that. Actually, this is a picture. Isn't one of them an actual picture?
Oh yeah, that's a photograph. I took that picture. Yeah,
Yeah,
that's right over near my house.
That was another one of his jobs that he had. He was a photographer.
I was a photographer.
Isn't that crazy? You just never know what you're going to hear on these webinars, guys. So good. All right. Looks like quite a few of our you are hopping on. Hello, Facebook viewers and YouTube viewers. There should be a link available for you guys to click if you want more information about these webinars. You can go to bartonwebinar.com and you'll find a link to our YouTube channel where you will find all of the replays of these webinars. You'll find replays of our type 2 diabetes webinars. You'll find our most commonly asked questions, just so much information. So I would just highly recommend that you go there. But if you have questions while we are on the webinar today, ask those in the Q&A if you're on Zoom. Facebook, you can do that in the comments. We'll do our best to get to those. YouTube, same thing. We'd love to hear from you. So Q&A, again, is where we can manage our questions the best way. If you want to let us know that you're here, that would be awesome. You can do that in the chat. Just say hello. You guys will be able to see who's all on here as well. So I'm coming to you guys from South Dakota. It is a beautiful 40-some degree day here. And for February 1st, that's great weather. How about you, Dr. Saunders? What's the weather looking like there? Perfect and wonderful?
Rainy. It rained really hard all night. Yeah.
Okay. Well, still probably nice out, though. What temperature do you guys have today?
I love the rain.
What temperature do you guys have?
Oh, gosh, I don't know. It's probably about 65.
Okay. Ooh, lovely. All right. Okay. Oh, yeah. Lots of people hopping on, guys. David is back. Hello. Susan from Washington. Jerry from St. Paul. Terry's from Texas. Don from North Dakota. Hello. Welcome. All right, guys, we're going to get started today. So this is the Healthy Heart webinar where we talk about all things heart related. And one of the topics that I mentioned we're going to talk about today is inflammation. And so let's have you, Dr. Saunders, maybe just share a little bit about that. This came up as a question last week. Someone had asked, how do I get rid of inflammation in my body? I feel like this is a really common thing. And in fact, I even was just talking to Dr. Saunders. I have a knee injury that we're trying to decide if I need surgery on, more than likely will. But it's hard to keep inflammation out of even my knee. And so that's what we're going to dig into today is, what do we do, Dr. Saunders? How do we get inflammation out of our body? Why does it matter? And share your wisdom with us. I think he's got to send a message quick. Okay. You go ahead. I'll show him some stuff. Okay, so, oh, are you done?
All right. So inflammation. Inflammation happens because Well, there's a lot of different reasons. So if you look at what inflammation is, it is a reaction that the body has to some kind of damage or some kind of problem, but there's usually some kind of damage going on. It could be from chemical problems. So, for example, if you have toxicity of some kind, you can get inflammation. If you have um, infections of some kind, any kind of infection can cause it, a virus, a bacteria, a fungus. And that's often chemical as well, because a lot of these, for example, fungus or bacteria or parasites produce toxins, and the toxins damage some of your own cells. And when your cells are damaged, they send out distress signals going, there's something wrong here. This is not supposed to happen. So this is really interesting, because when there's like an infection that's damaging cells, it's a completely different issue than when it's your own immune system taking out damaged or injured or dead cells. When your immune system goes, so there's like a whole bunch of cells. This is really weird the way this happens. So you see all these cells lined up, and they're like a row of houses, right? And the cell's going along, and it's kind of sniffing out the cells, and and there's stuff on the outside of the cells, and it's kind of like the row of houses that are all the same color, and they're all, oh, this one's pink, okay, 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 this one's blue. Blue, it's not supposed to be blue, it's supposed to be pink. And then what it does is it eats up that cell, it just completely eats it up, digests it, and spits out the amino acids. So it digests the protein completely. And that is does not cause inflammation. But when you have an infection like a virus, the virus gets into the cell, makes a whole bunch of other viruses, and then explodes out of the cell, so that the viruses spew out all over throughout your body. And when we're talking about a viral infection, we're talking about, when you measure in the blood, you're talking about millions of copies per cubic centimeter of blood. Millions. That's how many are in there. This is a lot of viruses. And then those cells that are broken open, they're leaking out all this stuff that's not normally in the blood, enzymes and proteins and microtubules and all these things that are not normally in the blood. So the immune system goes, oh my gosh, there's something wrong here, and starts investigating and finds the virus, and then starts making antibodies to grab up all those viruses that are all over, all those millions and billions and billions of copies that are being made. That's inflammation. So you think, well, I don't have any infections. But you might. So, for example, this came up, what Leslie was talking about, gum disease. People have infections in their gums, and it's just swollen and red and kind of irritating that you got this redness in your gums, and you brush your teeth. And when you brush your teeth, the bacteria actually get into your blood, and they're swimming around in your blood. And that inflammation is releasing these inflammatory mediators, they're called, into your blood. And that makes your immune system a little heightened, but it also does something else regarding heart disease. And that is, inflammation causes you to make something of what's called fibrinogen. Fibrinogen is a protein that clots are made out of. And so, because if there's some damage or injury, you want to be able to clot it off really quickly. So you make a little extra of this fibrinogen, and then you make clots more easily. If there's any damage done to your blood vessels or anything, then it clots up a lot. And also the other thing is that when you're in this inflammatory mode, you don't dissolve clots very easily. You don't take them up. So you have this blood vessel with, remember, it has that lining in it called the glycocalyx. And that's injured and damaged, and then it makes a clot there. It forms a clot because of the damage to that lining. And then the APCs come and pave over that to make a new vessel, and it's got the clot that's still on the inside of there, but it's paved over so that the blood vessel is still You can still put blood through there. But that clot has to be dissolved. What if you can't dissolve it? Then it just stays there and it organizes. And that's what it's called, organizing. And that's made into a fibrin, and this fibrous clot forms. And there's a lot of blood cells in there. Because there's blood cells, there's cholesterol in there. And all of that stuff it just sits there. And then if there's any other damage, because now there's a bump there, it's more likely to get damaged. And then so you wear away the glycocalyx, and you make more clot, and then you make more clot, and then you make more clot. But why isn't it dissolving? Well, because you're in inflammatory mode. You're doing inflammation, which causes you to clot and stops you from dissolving clots. And so this chronic inflammation is really bad for heart disease. Well, heart disease is really bad for your blood vessels generally, whether it's your carotid arteries or, strokes in your brain or in your legs or whatever. All of this chronic inflammation, it says to your body, oh yeah, be careful. There's something here that's wrong. And you're going to need to plug up holes and clot off the blood. And don't dissolve the clots, because then they'll start leaking. So now you're put in a really bad situation by having this chronic inflammation. Now, if you have it a little bit here and there, like let's say you get injured, actually, you fall down and you hurt yourself, and I don't know, even break a bone or whatever, then you need to clot all that off. So you got all this extra fibrin and you clot it all off. And then over a period of months, like 3 to 6 months, the inflammation goes away, it heals, your bones are healing, the inflammation's gone, you can start using your bones again, maybe 6 weeks later, and then the clot starts dissolving in there, and this is kind of a gradual process that happens. Well, what if in the meantime you get another injury? Then you're back to making more inflammation, and then you get every few weeks you're getting some kind of inflammation. Well, that's kind of like chronic inflammation. That's kind of like just having gum disease, or just having a chronic infection. People have Lyme disease. People who have toxins in their body. Some people take in toxins in their body. People with diabetes have excessive amounts of glucose, and they're not able to use fat for energy. So they have a lot of oxygen-free radicals creating inflammation. And that it's not that you have inflammation, it's that you never don't have inflammation where you can dissolve all the clots and clean everything up. Now, that's a really cool thing, because if you think about it, you go, well, what would I do? How do I get rid of all this chronic inflammation? I'm drowning in all this inflammation. There's a really simple, easy, cheap way to do it. So everybody thinks, they tell you have to start popping pills to get rid of inflammation. And there's actually some good research on that. Ibuprofen is actually a good anti-inflammatory, and it decreases inflammation, and it decreases your risk of heart disease, and it decreases your risk of cancer. But it's got some problems. It also prevents you from healing and causes stomach ulcers and bleeding stomach ulcers. You can't clot, so you bleed like crazy. And the aspirin does the same thing. So the anti-inflammatories, it turns out they're not the answer. Everybody thought, oh, I'll just take an aspirin. When I was in medical school, one of my professors got the Nobel Prize for figuring out how aspirin worked. And he told us in our pharmacology class that someday, he said, I remember him saying this, someday you're going to have an aspirin lick. And you're just going to, as you walk out the door, you're just going to lick the aspirin. And that's going to start your day so that you don't get any inflammation, and you don't get any heart disease, and you don't get any vascular disease. Well, it turns out that that's kind of been tried and tested. And yes, you do have decreased vascular disease, decreased heart disease, but the risk of getting bleeding problems is greater than the benefit you get from the aspirin. So it's not really a good idea. Okay. And then all these supplements, people are selling these supplements for like crazy prices. I had a woman, one of my patients, spent $9,000 to do incretin therapy. She was getting injections of peptides, peptide hormones, um, and in order to decrease the vascular disease. And I'm like, you know what? You can get all those incretin hormones for free. And it's really, really simple. All you have to do is have an empty stomach. When you have an empty stomach, it suppresses inflammation. I'm not talking about you just don't make more inflammation. It actually gets completely rid of inflammation. You have zero inflammation when you're fasting. So your stomach being empty is the single best thing you can do for heart disease. I had a patient who was told he had to have I've told this story before. He had to have a cardiac bypass surgery or he wasn't going to live a month. And this is a guy who couldn't walk across the room without getting chest pain. He was really in a bad way. He had bad heart disease. And so I told him about, you can heal this with an empty stomach. So maybe intermittent fasting. He goes, no. And this was his idea. I am not going to eat anything for a month. So for 30 days, he fasted. And during those 30 days, he went from not being able to walk across the room to playing a full tennis match. He was a tennis coach. He was playing a full tennis match and then going to the gym to work out and never had any more chest pain. In fact, for the rest of his, well, until now, I don't know. It's been 5 years and I haven't seen him in a year or so. But up until then, no chest pain at all. And so he essentially cured it with 30 days of water fasting. That suppresses inflammation and all those inflammatory mediators that cause you to make more fibrinogen and to cause clotting to happen and prevent you from dissolving clots all goes away, and you dissolve everything out. You take everything out. You clean up. Everything cleans up when you're not eating. It's just amazing. The more research that's done, the more remarkable it seems, because it's like miraculous. Everybody's like thinking like they have to pop some pill or I don't know, run a marathon or do something amazing to clean up their body or do a cleanse and a detox. I have people spending $10,000 to go to a cleanse program in San Diego, and you know what? You can do it for free at home. It's really easy.
It's easy, but you got to be in the right mindset. So sometimes I'm like, I understand why they're going to do it, but it is a mental thing. You do have to prepare yourself to do it. I love it. Just, we've been talking about fasting for a while, and my husband hasn't been eating after maybe at the latest 5, and he lost like 7 pounds in 7 days. So just letting you guys know. I mean, I didn't eat after 3 for like 6 days, and I didn't lose any weight, but that's normal. So I do feel good though. That has helped. So I do appreciate that. It's just so interesting. I know a lot of you guys are fasting too. So if you want to share some of your story, we'd love to hear from you. And I think it'll be fun to hear from these people who've been on the webinars for a while, when we check in with them in 30, 60, 90 days, what they're finding, what they're finding about themselves, what's changed for them, how their energy levels are, not to mention what's happening inside of your body. But those are the things you're going to for sure notice right away, right? So I'm excited to hear from you guys who are doing that. We're starting to get some questions coming in. So again, feel free to post those in the Q&A. Jill had asked, how long do you have to fast to get the benefits?
The benefits happen immediately when your stomach is empty. So as soon as your stomach is empty, and you get a hunger hormone called ghrelin, and that is the hormone that says I'm hungry. And you also hear this growling, gurgle, gurgle, gurgle in your stomach. And what that means is that's actually the cleansing part. You dump so much fluid into your small intestine, and it's cleaning out and washing out your small intestine. Your small intestine is very clean, and your body, if you give it a chance in between meals, if you have some space to have an empty stomach so that it can clean out, it will clean out so well that you have less bacteria than you do on your finger when you use antibacterial soap. It is really good at cleaning that out. So so that's the first part of fasting, and then you move into where you start using up your stores of energy. All of that extra energy that you've been storing for years starts getting used up, and that can take around 20, less than 24 hours. You're starting to use up glycogen. By 48 hours, you have no more glycogen left, and you start fat burning. And about 48 hours is when you start doing autophagy. Autophagy. Auto means self. Phagy is eating. You are eating yourself. And instead of eating food, you're not bringing in any food. So your body says, oh my gosh, I need food. Where am I going to get food? So it starts eating up all the stuff you stored over the years, including things like clots in your arteries. All these enzymes start coming out that clean up everything. So the tau proteins in your brain that have built up, the neurofibrillary tangles, the clots in your arteries. I already said that. What else? Cholesterol deposits. All that stuff, your body starts going, I need that, I need that, I need that. All the dead and dying cells, cancer cells. Oh my gosh, there's more and more evidence now. They've done some really good research on cancer to show that fasting even makes chemotherapy work better. If you fast during chemotherapy, like I'm talking about, like you haven't eaten anything for 48 hours before you do your chemotherapy treatment, it works 300% better. Like a lot better. Let's see, what else? Autophagy. You're eating up all of the excess stuff, and so what it is cleaning up your body, and that doesn't happen until you've stopped eating. Around 48 hours, you start autophagy, and that's all variable. 18 hours, whatever. But around 2 days. 72 hours is when you've gone into the fat burning mode. You've literally switched your primary energy source to a fat burning energy source. And that's a good thing. Why? Because remember, a lot of inflammation comes from burning sugar. So if you're burning sugar, if you're burning mostly sugar, that's creating a lot of inflammation. Fat is a low octane fuel. So you want to burn mostly fat, and normal people should be burning 60% of their calories should be coming from fat every day, and only 40% from carbs. So that is a pretty good ratio. But if it's the other way around, like if you have prediabetes or something like that, then you're going to make more inflammation because sugar is a high octane fuel and creates a lot more oxygen free radicals. So that's kind of the way fasting works. The first 24 hours you start using up glycogen. After that, you're starting to burn fat more, and you start autophagy, and then 72 hours you've switched to fat burning. And so it's about 3 days is when that full switch happens.
All right. Great question here from Darlene. How do you take pills when fasting? So let's talk about supplements and also maybe prescription meds.
Okay, that's a great question. So think of supplements as food. If you are not, if you're not eating, then consider the supplements as just food. You're not taking those either. That's fine. On the other hand, there are treatments. And if you're treating something like, let's say you have a thyroid problem, your thyroid doesn't work and you're on thyroid medication, you take the thyroid because that's a treatment. That's a medication. However, you have to be really careful. And this is where you need to work with your practitioner about what do I do about certain medications? Because when you're not eating, you should not be on medications that lower your blood sugar or that lower your blood pressure, because those will go down automatically when you're fasting, and they could be dropped too low from the medication. So the medication can cause hypoglycemia and low blood pressure. So if you get low blood pressure, then you can get dizziness and fainting spells. And hypoglycemia can cause similar kinds of symptoms. So you may want to be really careful and avoid those. I mostly tell my patients if they're on blood pressure or blood sugar medications, not to take them while they're fasting if they're doing the long-term fast. If it's an intermittent fast, like they're eating one meal a day or a 5-hour window of eating, then that's fine. They can take the medications in that case.
Jill says, I am assuming that we can drink fluids during a fast.
Okay. Yes. Yes. But you got to be careful because fluids that have taste, flavor, 0 calories, but they have flavor, like Coke Zero, for example. Oh, can we say that? Anyway, brands. Okay. So even like vitamin water that has vitamins in it, that has flavor, and they have these a lot of waters with flavoring in them. You need to avoid those. Pure water is fine. I guess if you're using like drinking like a plain Perrier water, that's fine. And actually, some research shows that black coffee, black tea, and teas that don't have any flavorings in them are actually pretty good. They don't break your fast.
All right. Let's see here. I know there are a lot. Oh, I'm looking at the wrong thing here. Okay, Jerry, this is a good question from Jerry, in which we kind of talked about this. To start, how many hours per day should one fast? And then someone had asked, does it make sense to start with shorter fasts before going into longer ones? Or does it matter?
Well, um, the does it matter question is actually no, but it's more of how you feel about it kind of thing. So if you start out with a shorter fast, you're less likely to get hypoglycemic episodes, and which I've done. I mean, I've been there. When I first started fasting, I would be at work and I would get low blood sugar, and I'd have to go lay down. And one time, it came on so much that I had to lay down on the floor in a nursing home. People are going, Doctor, what are you doing down there? Because I had to wait a couple of minutes there before the dizziness went away and I was able to stand up and move forward again. So one time I passed out in front of a group while doing a presentation. So you're really, really likely to get hypoglycemia, and it's not bad. It's uncomfortable. And so if you start off with like my daughter did, she didn't tell me about it. She just came, she said, I just finished a 14-day bone broth cleanse. I'm like, what? And this is a 5'2". She probably weighs 90 pounds. And, I said, that's too long. You shouldn't be doing that for doing. She goes, that's why I didn't tell you. And she did fine with it. She was in high school and she did fine with it. So people are different as to how they respond to them. For most people, yeah, kind of working up to it and see how you do with, start with a 12-hour fast. So that you have, 12 hours to eat between 8 a.m. and 8 p.m. And then go to a 14-hour fast. You're starting at 8 a.m. and going to 6 p.m. And that's not actually fasting. There is at night. You do have an empty stomach, and 14 hours is actually not good for you, because that's what they showed in a lot of studies, that it's too long to eat. After 4 o'clock, your enzymes to digest and all of the processing of your food that the liver has to do, those mechanisms, those systems shut down. So if you're eating at night, you're storing it in your fat, and you're just storing a lot of toxins because they're not being processed. And so that's when they start losing weight and they get toxic, because they've just been storing toxins all this time from eating at night. In the morning, when you wake up, your cortisol is released, and that turns on your liver. All your enzymes start being produced. So eating in the morning is a good idea. Eating in the evening is not a good idea. And then kind of Uh, and the beginning fast would be an 8 hour window of eating. So a 16-hour fast. That would be like 8 a.m. and to 4 p.m. between 8 a.m. and 4 p.m. That's kind of just a beginning fast kind of thing.
Darlene said, should I stop metformin and losartan before or while I fast?
Yeah. Metformin is one of those um, diabetes medications that doesn't cause hypoglycemia because it doesn't tell your body to make more insulin. It actually helps you to burn fat. So you could continue things like berberine and metformin. Those would be okay. Losartan is another one. The way it works is not to like dilate your blood vessels and cause vasodilatation and low blood pressure. So either one of those are unlikely to cause any problems during a fast.
Okay. Someone had also asked, what about blood thinners and aspirin while you're fasting? Should you take them?
No, no, that's a really good idea to go off of those because part of what you're doing is fixing your immune system, and those interfere with the chemical mediators for the immune system. So, no, it would not be a good idea.
Barry said, is there a preferred time of day to take blood pressure meds such as losartan, which I am on now? And that's, we're not talking about fasting anymore, just generally.
Yeah. Okay. So, blood pressure medications are generally taken in the morning so that during the day, it can keep, while you have a lot of cortisol and stress and all that stuff, it'll keep your blood pressure from going up a little better because there's always a curve, like you absorb it and then you kind of gradually it goes down. Some medications like losartan you can take at night. Because of the way it works on the hormone system, the renin-angiotensin system, instead of dilating blood vessels. So it doesn't work in the same way. So you can take losartan at night.
Okay. Steven said, just got here. Can you really unblock plaque from the arteries? I'm using your healthy heart support.
Yes. Okay. The healthy heart support does not unblock plaque from your arteries. Okay. Let's make that very clear. You can take all you want, and that's not going to do it. So the program is a comprehensive program. If you look at it, it's talking about your exercise and your diet and your stress levels and your emotional status. All of this is really important. And remember, we told the story last time about the rabbits that were getting petted and how they didn't get heart disease, and the ones that were just being fed and kept in a cage, they did get heart disease. So these are the comprehensiveness of the program does reverse heart disease, and so that's proven in many studies now. But there are several studies started by Dean Ornish way back in the 1980s. They were doing studies on this and proved that they could reverse it. That they actually would go in with a cardiac catheterization and put dye in there and show that they had blockage and now they got open arteries. So yes, it can be reversed. And that's the whole idea of the program, is to reverse this.
Okay, let's talk a little bit about our healthy heart support. I'm going to share my screen here. So I am at bartonnutrition.com, just so you guys can see that. And this is our website with all of our supplements. And we mostly talk about our healthy heart solution kit. And that is what we really recommend. But who is healthy heart support for? Who might be interested in this? And let me pull up, I want to show the ingredients here.
Okay, so the idea of healthy heart support is really a support for people who have heart disease, like congestive heart failure. So someone who's going into heart failure, there's a reason they're in heart failure. And yes, all of the points of the book, the exercise and the emotional aspects and the stress response and all that, those are all important, but those are part of it. And so because of dietary problems, that people aren't getting enough nutritional support, we made the healthy heart support to include some things that help the energy, like L-carnitine and coenzyme Q10, which are common needs in people who have congestive heart failure, but also to decrease stress like ashwagandha, or to increase the nitric oxide and dilate blood vessels like the beetroot. So this combination of things is to support people who have heart disease, and especially something like congestive heart failure. But it's not the answer. This doesn't fix the problem. This is a support. It's kind of like offering a foundation so that you have appropriate and adequate amounts of these nutrients and support for your adrenal glands. And it's really the program. The program is really where you're supposed to get the benefit.
So you can see I'm at bartonwebinar.com now, and here you'll find our Healthy Heart Solution Kit. And this is what we really recommend for everybody. So you can find that pretty simple, bartonwebinar.com. Use code webinar25 to save 25%. That is one word, and I will post that in the chat. Terry is asking if it's okay to continue insulin Lantus while fasting.
See, that's where you got to be really careful. Okay, so we're talking about heart disease. This is not the diabetes webinar, but that is really important, and I'm glad you brought it up, because someone who's injecting insulin without eating anything, without taking in any glucose or any sugars, is very likely to get hypoglycemia. And the mild hypoglycemia, like when I was telling you I was passing out, that's not a problem. It's the ones where you're injecting insulin and you're dropping below 30. Those are really, those actually damage your nerve cells, and it's not a good idea to inject insulin while you're not eating.
Okay. All right, guys, that's all we have for questions for today. You're getting us off a little bit easy. Oh, found another one. Another one came in. All right. Okay, someone had asked how to find the replays for these, and they are actually posted on our YouTube channel. So if you go to bartonwebinar.com, there's a link to our YouTube channel. You will find a lot of replays, really good information. And make sure when you get to the YouTube channel that you hit that subscribe button so that you'll be notified anytime that we upload a new webinar. How can I access the webinar? I'm at work and I'm in and out. So how can I view a webinar later? Oh, just told you. There you go. That was an easy one. In your session last week, I thought you said that a stent or not doesn't change your life expectancy. Could you elaborate? I had an LAD 97% blockage and was told I could have died.
Well, anyone could die anytime. That's a reality of life. So yes, you could have died, because that's the left anterior descending is a significant portion of the heart, and so if that were to completely block off, yes, that's a dangerous thing. One way to deal with that is to put a stent in it. There are other ways, and that's why we have the Healthy Heart Solution Kit. The stent, though, does not, statistically speaking, does not prolong life. Its purpose is to decrease chest pain, and that's pretty successful. That's what it does. It decreases chest pain. But if you look at the statistical analysis of the people who have stents versus people who have who need stents but don't get them, they live just as long. And that's the same with bypass surgery too. If you take into account the people who die from the surgery and everything, your chances, your length of life does not change by adding in a bypass surgery of your arteries.
Michelle says, what about nattokinase to clear fibrin?
Nattokinase is great, and it is an enzyme that does clear fibrin, and it's really good. So there's actually two of them, nattokinase and lumbrokinase, which are good at clearing out those clots in the arteries. And so, yes, that's something you can take. But remember that if you're all inflamed, if you're making a whole bunch of fibrinogen, then that's making fibrin clots. And the nattokinase may help clear some of that, but it's not going to overcome what your body is making. So you still need to get your inflammation down so that the nattokinase or lumbrokinase can work.
Okay. Ted said, should I fast more than 3 days to get more benefit from fasting?
That's a good question. Okay, the answer is the more you fast, the better. There's just no way around that. The more of the anabolic hormones that you make, gosh, this is so big, guys. I got to tell you, when you eat, when you're awake, when you're stressed, making cortisol, and when you're active and doing stuff, you are breaking down your body. It's called the catabolic hormone or catabolic metabolism. The catabolic hormone is cortisol. And that's what you get in the morning. And that's what wakes you up and gets everything going, right? Gets your intestines working so you can digest and absorb your food. All of that is going on. And that's really important stuff. But while you're doing that, you're breaking down your body. You're causing damage to all of the stuff. Like, you're out skiing and you injure your ACL and then you have to have surgery on it. And that's all damaging, right? You get to repair every night if you get anabolic. And the anabolic metabolism requires that you have to be asleep by 10 o'clock and that you have an empty stomach. And that empty stomach means fasting. That's what it means. And so if you eat at night, forget it. You're not going to get anabolic. You're not going to rebuild or repair or regenerate anything. So that that is the importance of the fasting. Now, let's say you want to get anabolic for a long period of time. Then you want to make a hormone called ghrelin. You know what ghrelin is? It's the hunger hormone. It tells you your stomach is empty. It's time to eat. And so when you're hungry, that's like, oh, good, I'm hungry. That's good. That means I'm making ghrelin. That means I'm going to make growth hormone. That means I'm going to get anabolic and repair everything in my body. I'm going to fix everything. And that's the advantage of fasting. So how long do you want to do that? Do you want to repair for an hour? Do you want to repair for a day? Do you want to repair for 6 days? Do you want to repair for 10 days? How much repair does your body need? There was a guy in 1968 who fasted for over a year, no calories, 0 calories. He had a vitamin pill, black tea, water. That's it. For over a year. And he lost, I think it was almost 300 pounds, like 280 pounds or something like that. He lost during his fast and repaired everything. Like everything came back to normal. And then 5 years later, they went and looked him up, and he was still 180 pounds, and he was still happy and healthy and was doing well. How long do you want to fast? Well, how much can you tolerate? If you weighed 480 pounds and you wanted to lose 300 pounds, then yeah, you could go a year. If you have an extra 10 pounds, then go 10 days. You're going to lose about a pound a day. That's the expectation. It's a little less, like 0.8, 0.9, something like that. So if you have 30 pounds to lose, fast 30 days. That's the easy way to look at it.
Don said, I haven't heard any talk about triglycerides. How critical is it to monitor triglycerides?
Oh, it's not critical. It does give you some information. If you have high triglyceride, what that means is your body's not using fat for energy very well. And so you want to get those triglycerides down. What that means is then the cells are taking up the fat and to burn it for energy. And then you're having more fat burning and less sugar burning. And that's what prevents you from getting a lot of inflammation. So you could monitor triglycerides, and they should be around 100 or under 100 is pretty good. If your triglycerides are 200 or 300, then you're probably just not taking up fat for energy at all.
Graham says, what is the best time of day to take fiber greens?
Um, well, I don't know that there's a best time. Because yeah, you know what? Since it's food and since it has a sweetener in it, stevia, I would say take it in the morning. Yeah, in the morning would be a better time.
Anonymous had said, can we use flavor in the water? I'm assuming when we're fasting.
The answer is no. Plain water, black coffee, black tea, no flavors. That actually is important. That's not that that's been researched and it's clear. That's actually a no-no.
Let's see. Cardenius says, I have a chart on what happens each day of continuous fasting. That's awesome. I think I've seen some of those before, and that it is
Yeah,
really, it's kind of motivating when you know what's
yeah.
happening in your body too. Very cool. Harry says, I exercise for almost an hour a day after my heart rate is in the 50s. Is that a problem?
No, people who work out that much, they actually get lower heart rate. What happens is the heart gets really efficient, and so you get a bigger heart, and it pumps more of the blood out with each heartbeat. So you actually don't need as many heartbeats. So someone with an average kind of person who's like 50 to 60% ejection fraction and their heart is small, they're going to need 70, 80 beats per minute to get circulation throughout their body. Whereas someone who's working out a lot, they actually have a larger heart and it's more efficient. So it beats 60 to 70% of the blood out each time it beats, pushes it out. And it's larger. So you're getting a lot more blood with each beat. And because of that, you need fewer beats to get the blood around. So by itself, no, that's not a problem.
Paul says, what's better, multiple 3-day fasts or one 7-day fast?
That's a good question. I don't know. I've read a lot about fasting and I don't know. It seems like if you're doing it on a more or less regular basis, it's better than the people that just do it one time and then skip it for the rest of the year. I actually had somebody, a patient of mine, who did a 10-day water fast once a year. And that seemed to work because he had rheumatoid arthritis, and it seemed to keep his inflammation better than using the medications. He didn't want to be on medications. So I don't actually know which is better.
All right. Michelle says, how much exercise is okay during fasting? I do a lot. I'm a teacher and I'm ravenous after. I prefer not going into low blood sugar.
Yeah. Well, exercise is good for you, and exercise while you're fasting is really good for you. So you can do as much exercise as you want to do while you're fasting.
Jerry says, is moringa tea as good as some say it is?
Um, I suspect it's not as good because I've read about it that it's ascribed magical qualities.
Oh.
And I suspect that it's really not magical. Some things are really good and they actually have things in them that people go, wow. A lot of people are deficient in PEA. So, it has PEA in it and people take it and they go, wow, I feel so much better because I have this neurotransmitter. But you know what? Yeah, people drink tea and coffee and feel a lot better too because of the caffeine wakes them up. So I don't know, if feeling better doesn't, is that, a magical quality? I don't know. Probably not.
Any thoughts on bulletproof coffee?
Um, yeah, bulletproof coffee is fine when you're not fasting
Yeah.
because it's not fasting. It's actually got a lot of fat in it. So,
Yeah.
and it's okay for people on a keto diet, for example,
Yeah.
and that's fine, but not during a fast.
Paul says, how may we get your preferred numbers on levels of lipids versus those from conventional medical sources?
Yeah, that's a really good question because the conventional medicine, the numbers that they put in for normals, are unfortunately normal. So, if you haven't, the average person is sick, like the average American is overweight, then you're going to have different numbers, and the average American is insulin resistant. So you're going to have everything skewed towards insulin resistance as being normal. So normal is not necessarily good. So things like, okay, triglycerides. We talked about triglycerides. Under 100 is better. And I know most of the labs around me put it at 150 is normal. For cholesterol, well, we've talked about this extensively, and the optimum cholesterol is around 130. So between 120 and 140, that range is actually the optimum place to be for any age, male, female, doesn't matter, any race. That is a very consistent number in all the studies. For LDL cholesterol, that's a calculated number, and it's really not useful, and it's not related to heart disease. That's where we came up first. Our first episode, we talked about the UK, the United Kingdom study using AI. And the AI, since it doesn't have an agenda, right? The AI just spits out what it sees, and it put LDL cholesterol number 46 out of 48 for heart disease as a risk factor for heart disease. In other words, it had no effect on heart disease. So knowing that number is useless number anyway. The cholesterol, total cholesterol to HDL ratio has been shown in some studies to be useful though. And so that should be below 4, ideally in the 3s, maybe even 2s. That means you have as a part of the total cholesterol. If it's 2, that means you have twice as much of the LDL as the HDL, and that's okay. That's actually an okay number, and that's really good actually. Let's see, what were the other like omega-6 to omega-3 ratio? Yeah, that should be. I had someone at 2. I'm like, that's excellent. So between 2 and 4 is an optimum place to be for your omega-6 to omega-3.
This is a really good question and something for all of us to keep in mind. So let's say we're fasting with the goal of getting off of metformin or losartan. How do we know when we can stop those?
When you don't need them anymore. So if you have normal blood sugar, why would you need metformin? If you don't have insulin resistance, then you would just say, I don't need that anymore. If your blood pressure is normal, or especially if you're getting low blood sugar or low blood pressure, then you're going to say, well, those medications are not good for me. They're dangerous. So it's not a simple formula. It's really just your own functioning.
Carolyn said, so Carolyn did a 5-day fast and had electrolytes with stevia. What did that do to her?
Okay, so stevia, the electrolytes are fine, actually. You can put salt in water or something, but the problem with the stevia is it causes you to release insulin. So during your fast, you're making insulin. Insulin will cause, if you're not insulin resistant, then it'll cause the blood sugar to drop down. And then you have to make glucagon so that your liver can put out extra sugar. And so it can lead to insulin resistance. It's not a good idea to fast with anything that has flavor or sweetness, especially sweetness.
Okay, question here from Tom. So now I understand what you're saying, Tom. I think he maybe worked with one of our coaches and got the diabetes solution kit, and he's trying to figure out why they had recommended the healthy heart supplement to him when he has diabetes. And I think, truthfully, Tom, I use the healthy heart supplement, And I think a lot of people on our team do because the stuff that's in it is so good. But why might somebody want to use it who, doesn't have any heart issues? Which I think we kind of talked about.
Yeah, we kind of talked about that because diabetes is one of the issues with like inflammation, and it lowers stress, makes you less insulin resistant. So the ashwagandha in there helps the adrenal glands to not put out so much cortisol because cortisol makes you insulin resistant. So the program, the diabetes solution kit, the program is to increase insulin sensitivity, which the healthy heart supplement can be helpful for. But it's not the answer. The book is the answer. The supplement is a helper.
All right. Anonymous says, I have been on blood pressure meds for the past 20 years since I was 47 years old. Now I'm in my 60s. Do blood pressure meds affect male performance? What can be done? Is it dangerous to take male enhancement when on blood pressure meds?
Oh, wow. Yeah, absolutely. Blood pressure meds have been well known to cause erectile dysfunction in men. And then the male enhancement things are probably not going to help that at all. And so there is actually a blood pressure medication you should switch to. And it's actually a good blood pressure medication. It's called Cialis, or Viagra. Viagra you may have to take twice a day. Cialis, it's longer acting, so you can take it once a day. And it's a blood vessel dilator. So it lowers the blood pressure and it helps your sexual performance. So for both of those, you might want to talk to your doctor about changing to see if that's an option for you.
Okay. That's it for us today. Thank you
All
so
right.
much, Dr. Saunders. We'll see you next
Good.
week.
Okay.
Thanks everyone for joining us today. Again, you can head to bartonwebinar.com. That's where you'll find all the information about these webinars. Use code webinar25 to save 25% as well. And I will see you all next week. Thanks so much for joining us today. Bye-bye.